afternoon, everyone, and happy Friday. Thank you for joining us for this webinar on the connections between education and health. My name is Becky Sestersick-Carroll, and I am a health policy analyst at the Health Policy Institute of Ohio, or HPIO. For those of you who may not be familiar with HPIO, I'm going to start by giving a very brief overview of our organization. HPIO is a small nonprofit organization dedicated to providing the independent and nonpartisan analysis needed to create evidence-informed state health policy. We are funded by a number of health foundations across the state, many of which came together to create our organization in 2003. So this slide shows a list of our current core funders. Oh, I'm sorry. There are our current core funders. Our primary audience is state policymakers, with kind of a secondary audience being other stakeholders who engage in the policymaking process. So on today's webinar, I'm going to start by explaining HPIO's work surrounding the relationship between education and health, and then I'll go on to explain this relationship. Then we'll hear from Tom Lasley of Learn to Earn Dayton, who will talk about Ohio's educational attainment goal, why it's important, and what some of the barriers will be to reaching this goal. Next, we'll hear from Laura Rooney from the Ohio Department of Health, who will talk about how health impacts learning and educational attainment. After that, I'll quickly share some information about HPIO's 3 upcoming publications on education and health before we open it up to your questions. So I'd like to start by explaining why we decided to explore the connections between education and health and why we felt that this information may be of interest to Ohio policymakers. We found that health and education separately are both areas of significant focus for state policymakers, both from a budgetary standpoint and a policy standpoint. This pie chart shows state and federal general revenue fund appropriations for state fiscal years 2016 and 2017. You can see that more than half of the appropriations went to health and human services, and an additional third went to education. Also, HPIO did an analysis and found that of the 971 legislative bills that were introduced in the previous General Assembly between January 1st, 2015 and November 4th, 2016, 42% of them were related to health and/or education. So these are obviously 2 areas receiving considerable attention from Ohio policymakers. Also, we know that Ohio has room for improvement in both health and educational outcomes. This chart shows educational attainment for Ohio and the overall U.S. So you can see here that of Ohio adults, 9% did not attain a high school diploma, and another approximately 32% have no education beyond high school. This chart shows the percent of students scoring at or above proficient on a national assessment. Although Ohio students scored better than the U.S. overall, you can see that there's still a lot of room for improvement as these percentages are all fairly low. This table shows Ohio data for some key health indicators. The last column shows Ohio's rank relative to the other states in the District of Columbia, and a rank of 1 indicates the best performing state. So you can see that Ohio is not doing so great on any of these indicators. I'd also like to mention that the data in this table also gives you a sneak peek into HPIO's 2017 Health Value Dashboard, which is going to be released this upcoming Wednesday. So stay tuned for that. Very exciting. HPIO's work exploring the connections between education and health started this past summer. To guide this work, we decided to convene an Education and Health Policy Advisory Committee comprised of individuals from around the state from both the health and education sectors to discuss policy implications and policy opportunities surrounding the relationship between these two areas. Our two guest speakers on today's webinar were two very valuable participants in this advisory committee. So last month, we released the first of a series of education and health publications. It's called Connections Between Education and Health, and it was meant to give the reader a better understanding of this relationship and the factors that contribute to it. We will also be drafting 3 additional publications that will offer more specific policy recommendations, but I'll explain those a bit more at the end of the webinar. We also developed an online resource page, which is where folks can go to find lots of other resources on education and health policy. It starts with the section that is sort of like an Education Policy 101. So it includes some basic information on education policy for those individuals from the health sector or others who may be unfamiliar with the world of education policy. Then we have a section on health basics for education folks, which is a similar idea. And then after that, there's lots of resources about the intersections of education and health, some specific policy topics, and promising models of integrating health and education. The resource page is on HPIO's website, and we're going to be adding to it throughout 2017. So there might be some topics now without any resources listed yet, but there's already a lot of information there, and I would really recommend you take a look if you're interested in learning more. And then keep checking back every so often, because as I mentioned, we'll be adding to it all the time. So now I'm going to briefly go through the content of the policy brief. We know that there's a relationship between educational attainment and health. This chart shows the percentage of Ohio adults who reported their health as fair or poor, and it's broken down by highest level of educational attainment. So you'll see that more than a third of those without a high school diploma rated their health as fair or poor, compared to only 6.5% of college graduates. Here you can see that there are also wide gaps in chronic disease prevalence among these groups. And this also translates into life expectancy. So someone who has not graduated from high school is expected to live an average of 9 years less than a college graduate. In this brief, we explain some of the key reasons why these gaps exist, and we identify 3 primary ways in which education and health are connected. First, education impacts health through creating opportunities for better health. And secondly, the relationship also goes in the opposite direction in that health can affect educational success. And finally, there are other factors such as poverty, geography, stress, and parenting, which can influence both education and health outcomes. So I'm going to give you a brief overview of each of these 3 pathways, and I'll start by explaining how education impacts health. Unsurprisingly, more education generally allows people to have better jobs, which pay higher salaries and offer better benefits such as health insurance. These financial resources then pave the way to better health through the ability to live in safer and healthier communities, which have greater access to healthy foods and more opportunities for physical activity, and access to stable housing free from toxins such as lead. This also enables better access to healthcare, and those with more education and greater financial security also live with less stress generally. People with more education also generally have higher health literacy, which often means they're more likely to practice health-promoting behaviors such as eating well and exercising regularly, and to refrain from smoking and other unhealthy behaviors. And further, these individuals are better able to navigate the complex healthcare system. So they're more likely to understand their health needs, be able to communicate effectively with providers, and to successfully follow complex treatment instructions and medical advice. And then finally, Individuals with higher educational attainment are also more likely to have high levels of social support, which can often include close friendships and a stable and supportive marriage and family. And those with higher levels of social support tend to experience better physical and mental health outcomes. The second part of this relationship is that health can also affect educational success. When children are not physically and emotionally healthy and well-nourished, they're more likely to miss school and may not be able to pay attention and learn while they're in school. Of course, both of these factors can hinder educational success. For example, chronic absenteeism is one way that health can affect educational performance. Students who miss more than 10% of school days for any reason are considered to be chronically absent. So not only do these kids risk falling behind their peers academically, but chronic absenteeism has been found to be a strong predictor of students dropping out of high school. And Laura is going to be going into quite a bit more detail about how health can affect education outcomes in a few minutes. Finally, the third aspect of the relationship that we discussed in the brief involves these other factors that impact both education and health outcomes. We explained that a lot can happen to impact a child's future educational attainment and health before he or she even steps into kindergarten. For example, prenatal health and a child's first few years of life are critically important for brain development. Children born to mothers with lower levels of educational attainment are more likely to be born prematurely or with low birth weight, both of which are predictors of future health problems and have been found to have harmful effects on educational success. We also explained that when a child lives in a stressful environment and or experiences traumatic events, what are often called adverse childhood experiences, this can cause harmful biological changes that lead to poor physical and mental health, as well as lifelong cognitive limitations and behavioral problems. I'm guessing that some of you are familiar with the ACEs study from the late 1990s. It found that when a child is exposed to these adverse childhood experiences, or ACEs as they're commonly called, which are listed on the bottom of this pyramid, not only does this affect brain development, but the child is also much more likely to develop risky or unhealthy behaviors such as smoking, alcoholism, and drug abuse, and it also increases the probability of developing many different health conditions later in life, including heart disease and cancer. So we didn't provide any specific policy recommendations in this publication, as it was simply supposed to explain the relationship and the problems that currently exist. As I mentioned, however, our 3 upcoming publications will explore more specific policy recommendations. We did provide some general guidance for policymakers, and this slide shows a few of our suggestions. First, we recommended that policymakers prioritize evidence-informed policies with both education and health benefits. So an example of this would be establishing school-based health centers in low-income communities. We also recommended that policymakers consider the impacts of education policies on health outcomes. This might include education policies such as school district decisions to reduce recess time and or decrease physical education requirements. And then similarly, we suggest that they consider the impacts of health policies on education outcomes. For instance, changes to Medicaid policies to reimburse for health services provided to low-income children in schools is something that would likely have education implications. And then we also would like policymakers to ensure that all students receive comprehensive, age-appropriate, and consistent health information in K-12 education. And finally, we also recommended that policymakers encourage stronger partnerships and greater collaboration between the education and health sectors at the state and local level. This slide simply shows some of the health and education-related state agencies, as well as some of the relevant legislative committees that this suggestion could pertain to. And finally, in the past several weeks, there have been a few examples in Ohio of this information being translated into state policy. First, Governor Kasich recently released his proposed budget for the upcoming biennium, and one objective listed in it was to increase academic achievement through better school health. It includes provisions to support school districts that want to form school-based healthcare partnerships, and there are also provisions to incentivize primary care practices and Medicaid managed care plans to focus on better school health. Secondly, Ohio also recently released its 2017 to 2019 State Health Improvement Plan, or SHIP. The SHIP addresses 3 priority topics: mental health and addiction, chronic disease, and maternal and infant health. And it includes various evidence-based strategies that relate to education. Some of these include school-based health centers, early childhood education, school-based social and emotional instruction, safe routes to school, and school breakfast programs. The SHIP also includes 5 education-based indicators to be tracked, and these are preschool enrollment, kindergarten readiness, 3rd grade reading, chronic absenteeism, and high school graduation. And then finally, the Ohio Department of Education recently released its draft state plan required under the Every Student Succeeds Act, or ESSA, and the state plan proposes to measure student engagement by tracking chronic absenteeism and school discipline incidents. It also sets targets for improvements in chronic absenteeism and high school graduation rates in our state. So now I'm going to pass it over to Tom Lasley. Thomas J. Lasley II is the Chief Executive Officer of Learn to Earn Dayton at the Dayton Foundation and Professor and Dean Emeritus for the School of Education and Health Sciences at the University of Dayton. From 1998 until 2010, he served as Dean of the School of Education and Health Sciences at the University of Dayton. He serves on a variety of nonprofit boards or committees, including Dayton Literacy Peace Prize, Public Media Connect, National Council on Teacher Quality, Air Camp Incorporated, Dayton Metro Library Foundation, and is a regional community liaison to the Air Force Materiel Command, United States Air Force. He has published in excess of 70 articles in professional journals and has authored or co-authored 14 books. In 2006, he received the National Conference for Community and Justice Humanitarian Award. In 2015, he received the University of Dayton's Lassner Award for contributions to the Catholic and Marianist nature of the university's culture. In 2016, he received the Visionary Leader Award from Knowledge Works for his work with early colleges, regionally and nationally. So I'll hand it over to Tom.
Thank you, Becky. It's a pleasure to be here. I'm going to talk through some very basic information around Ohio's attainment goal. And as you can see by the first slide, one of the things that Ohio has done is establish a 65% goal, and this is for all of the 25 to 64-year-olds. That is, individuals who are in the prime of their working life with some type of marketable degree or credential by the year 2025. If you look at this figure, it appears to be daunting, and in fact, it is daunting. It's going to be very difficult for Ohio to achieve this goal, especially as you'll see as we proceed in the short remarks that I'm going to make, with the fact that right now the state of Ohio stands at 43% of our population with some type of 2 or 4 year degree or marketable credential. And that's broken down by about 37 to 38% with degrees and about another 5% with marketable credentials of some type. So you can see there's a real delta of around 20 to 22% between where we are and where we need to be in 2025. Across the country, you see states setting these goals. 2 states in the United United States are going to hit the 60% goal that Lumina has set. The Lumina Foundation out of Indianapolis has probably been the most aggressive on the intellectual capital attainment effort, and they've set a 60% goal. And they perceive that North Dakota and Massachusetts are the only two U.S. states that are going to hit the intellectual attainment goal that they believe is necessary for economic vitality. As you'll see by the next slide, I argue that there are basically 4 reasons why the attainment goal is critical. I might add that the state has set this goal in collaboration with the Ohio Department of Education, the Ohio Department of Higher Education, and the Governor's Office. And if you analyze the reasons for why they've set the goal, one, it's related to economic vitality and viability. The number of researchers who study workforce argue that the next 10 years, it's not going to be a battle about jobs. It's going to be a battle about who gets the good jobs, which communities get the good jobs, which states get the good jobs. I define a good job as anything that pays a living wage of approximately $22 or more an hour. To secure that type of wage, you are going to need some skills, and you're going to need skills that go beyond a high school education. So the first thing is attainment's absolutely related to economic vitality. The second thing is Becky has already alluded to and described attainment is related to reduced healthcare costs and just the overall health of the population. Third, attainment is related to reduced crime. We know that as educational attainment rates go up in communities, crime rates go down, and so it makes it better for all of those who live within our cities, our urban areas, whatever area of the state that you live in. As your population it becomes more educated, you'll see that your crime rates are mitigated. And then finally, attainment fosters some sort of family economic security and personal self-sufficiency. Right now, we see young people trying to achieve the high school graduation requirements that have been established, and there's great debate across the state about what those requirements should be. I'm not going to weigh in on what I think is best. What I am going to share is that it's a very, very important debate for all of us to be engaged in. We need to make sure that our young people graduating from high school have the skills that they need in order to be successful as adults and in order to be able to secure a living wage. Please understand that in the past, many people who had an absence of skills could pursue jobs that required very low levels of training. Those jobs might be cashiers in grocery stores. Lots of people were employed in that way. The problem is, as most of us well know, cashiers will probably not be around, at least certainly not in the numbers that we have right now. They're not going to be around in the next decade. We're going to have driverless cars. We're going to have lots of capacity to perform tasks that in the past we had unskilled labor available. In the future, that simply is not going to be needed. So those are the 4 reasons why I think the goal is critical. If you go to the next slide, you'll see that what I perceive to be the essential benchmarks for enhanced attainment. Becky already alluded to a couple of these, kindergarten readiness, 3rd grade reading proficiency. I've also identified 8th grade math proficiency. 8th grade math proficiency is a wonderful predictor of whether a young person is going to matriculate in a post-secondary program. 3rd grade reading proficiency is a wonderful predictor of whether you're going to graduate from high school. We then have high school graduation as a 4th benchmark. Right now, about 4 out of 5 of our students in the state of Ohio are graduating from high school. We need to get that figure up. We need to try to make sure that not only are young people graduating from high school, but they're also college and career ready so that they can enroll in a post-secondary program of some type. and then graduate within 6 years of high school with some sort of degree or credential. If you look right now at the county that I come from, we have about 37% of our young people securing some sort of college degree. That matches very closely with what the state of Ohio has, which is around 36 or 37% of our population with a college degree. And we need to impact that figure. And as that figure is positively impacted, it's going to also influence what happens in terms of healthcare costs. I would encourage all of you who are on this webinar that you, and I don't have this on one of the slides, but I'll give it to you verbally, and that's to go to lumina.org. If you go to the lumina.org site, you will see there the attainment figures for every county in the state of Ohio. So Lumina actually listed, I went through it very quickly. I'm right now sitting in Franklin County at the present time for ages 25 to 64. 45.97% of the individuals in Montgomery County have some sort of college degree. Adams County is one of the lowest in the state, that's 17.28%. Again, the county I'm from is around 37. I might add that for those of you who live in Delaware County, congratulations, you're at 61.91%. You're almost at the attainment rate that you need to be at according to both Lumina and according to the state goal. I have two more slides. In order to achieve the goal, I think there are three things that are absolutely imperative. And I'm a big believer in using data and then trying to use that data in ways that will inform practice. I'm encouraging you to really have a strong understanding of the attainment data for our state, the state of Ohio, and that's why I'm encouraging you to look at the lumina.org site. I'm also encouraging you to look at the data for your county. I gave it to you for 4 counties, Franklin, Delaware, Adams, and Montgomery County. But I'm encouraging you to look at the county that you are located in and determine what the attainment rates look like. And then I'm encouraging you to know the attainment data for your local school districts. I might add that one of the things that I think has placed Ohio behind some other states is that we don't require all of our school districts to collect National Student Clearinghouse data. That data is essential for knowing whether young people have graduated from college with either a 2- or 4-year degree after 6 years out of high school. And because we don't collect that data uniformly across the state, I think it puts us at a bit of a disadvantage. But I can tell you that if you look at the 612 or 613 school districts in the state of Ohio, you will see that a significant number are collecting this data. And in fact, in the county I'm from, Montgomery County, every one of the 16 public schools districts collects and publicly disseminates that data to their stakeholders and parent constituents. And the attainment rates match and mirror the poverty rates for a community. So you look at your most affluent school districts, you're going to see that about 6 or 7 out of 10 students are graduating from college. If you look at the most high poverty districts, it's going to be down in the 1 to 2 range. I might add that some states across the United States have set incredibly aggressive goals. I just heard a presentation from a group in Boston. Boston right now has set an ambitious goal with somewhere around 60 to 70% of all their high school graduates getting college degrees, and this past year they were at 51%. That's incredible for an urban district to have that. My final slide is what will keep Ohio from achieving the goal. I think one is the lack of public will. A lot of people don't understand the significance of having a college degree or a marketable credential. They believe that they were able to secure jobs without those kinds, without that kind of intellectual capital. They don't know why it's necessary now. The problem that we have is that according to a number of different groups, in the future, around 2 out of every 3 jobs are going to require some sort of post-secondary expertise. And having young people who have no high school diploma, or as Becky indicated, just a high school diploma, those young people are going to really have a high likelihood of a life of poverty unless they can secure something beyond that high school diploma. So we need to have all of our constituents, all of our stakeholders arguing and advocating and fighting for our young people to secure as much intellectual capital as they can. Failure to think systemically. We have a very siloed system. I think you see efforts to try to align systems. In fact, that's what HPIO is doing. It's trying to align in a way that's reasonable, align what's happening in health and education. The two are related. They certainly have differences, and those differences have to be addressed, but there are points of alignment, and where those are, you need to think systemically. Third, we need to think about the marginalized groups. The real problem, and we just did this in the county I live in, we disaggregated data, and you can see clear differences between our African American young people and our students who come from mainstream culture, and it really is creating significant problems for us as communities. You have marginalized groups without the skills that they need in order to be successful and to compete in the economy of today and the future. And finally, there's a failure to address the barriers to attainment. And one of those barriers, one of the big barriers is college affordability. There are others, the college and career readiness of our young people. I've already suggested that that's one of the reasons we're having such a fight over the 18-point requirement for young people to graduate from high school. But even those students who graduate from high school now have real challenges around college affordability, particularly when you consider the fact that the state of Ohio ranks 45th in terms of affordability of a college education. Several states, Tennessee, among them, have now made it possible for young people through a Tennessee Promise to virtually go to college free, especially, particularly for those first 2 years. And Ohio needs to think more aggressively and ambitiously about what it's going to do in terms of dealing with the college affordability problem. Again, that gives you a bit of an overview. It's a cursory overview, I admit, but I hope it gives enough to stimulate your thinking. And with that, I will turn it back over to Becky.
Thank you, Tom. I'm now going to pass it over to Laura Rooney. Laura is the Adolescent Health Program Manager for the Ohio Department of Health. She has a bachelor's in health education from Ohio University and a master's in public health from the Ohio State University. Laura has 20 years of experience in providing technical assistance and training to schools and communities on strategies to improve the school health environment. She has spoken at the national, state, and local levels on the connection between health and academics. In October of 2015, Laura was the lead author on an article in the Journal of School Health on implementing the whole school, whole child, whole community model. So now I'll turn it over to Laura.
Thank you, Becky. Thank you. This presentation will really kind of give an overview of the connection between health and learning and how students truly are better learners if they are healthy. This slide comes from the Ohio Department of Education. I think it really sums up what we're trying to do and with this brief from HPIO and putting a mirror to what Tom was talking about with educational attainment. Is that every child graduates and has the knowledge to succeed in life. And in order to do that, we must have a balance. We must look at the academic content standards and make sure that there's high rigor, but then also in order for the students to achieve and meet that rigor, they have to have the right conditions of motivation for learning. And what I've been doing over the past number of years is helping school districts look at those conditions. What is the climate? What's happening with students within their lives when they're coming to school, what's happening at school, what's happening when they go home, and how can, as Tom said, how can we systemically make changes for improvement? This really sums it up with these 3 bullet points. The students cannot learn if they're not healthy. There's many barriers to learning if they're not there. If there's discipline issues, violence, truancy, and dropout, that just automatically puts them behind. And then we have to look at the students' physical, social, and emotional health to help them achieve academic success. One of the things many teachers, if you ask them what are the things that prevent students from learning, they talk about the baggage that they come to school with, and that schools have to help deal with some of these issues. And in this cartoon, it's just so real. Students are hungry, they're homeless, they may be pregnant. We don't know what happened in their home that night, were their clothes clean. And so these are real issues that students face in every single one of our schools in Ohio. Dr. Charles Bache out of Columbia University did a study, and what he looked at is the disparities between health and education. And this study was done in an inner city school, and he showed that poor health and health disparities are the underlying cause to the achievement gap. They looked at what was happening in the schools and within the staff, and really showed that it doesn't matter what curriculum, school management changes that are needed to be made, what technology you put in place, we have to address the health needs of the students. And so if you want to read more about this, this is where you can find it. Healthier students are better learners, a missing link in school reforms to close the achievement gap. These are the things that he examined. He looked at the academic indicators of discipline, grades, absenteeism, truancy, dropout, and school climate. Our districts in Ohio are held accountable to these areas. And he found what he calls 7 educationally relevant health disparities, which are vision, asthma, teen pregnancy, aggression and violence, physical activity, breakfast, and inattention. These health measures directly impact the academic indicators. And so as schools are trying to reach these standards in which Tom outlined, we have to help school districts and communities reduce the percentages and the rates and the risks that students are experiencing on the health side. In the state of Washington, several years ago, they did a study that looked at the number of health risk factors, and as the students had more health risk factors, their academic risks increased. This goes to parallel what Becky was talking about with the ACEs studies. The health risks were part of the ACEs. They were also part variables that are in the Youth Risk Behavior Survey. When you look physiologically at our brains and what our brains need to learn, they need proper nutrition, they need hydration, students need proper amounts of sleep, they need physical activity, and they need to have a sense of safety and security. If these are the physiological things that our brains need to learn, what emphasis are we placing on this within our academic institutions? So just think about that. And we need more priority on this so that the physical body can obtain and retain the information. Dr. Chuck Hillman out of the University of Illinois has conducted a study related to physical activity and brain activity. He studied students and he looked at brains that were sitting quietly and brains after 20 minutes of walking. And you can clearly see by the color indicators that brains that had those students that had been walking, they had an uptake of oxygen and it lit up the brain. They were also able to receive and retain more information and stay on task. There's many, many studies that have been conducted that prove the connection between health and physical activity and learning. Some of the high points of the research that's out there shows that students who are more physically active have higher grade point averages, they do better on tests, they have improved memory and concentration, they have improved classroom behaviors, reduced dropout, and greater odds of attending college. When we think about our state's goals that have been placed before us, it just makes sense that we need to encourage more physical activity to help us reach those goals. Thinking of breakfast and students that come to school hungry. Students miss less school, that's eat breakfast, and they have 17.5% higher scores on math tests. Ohio also participates in an effort called the School Breakfast Challenge. You can Google that. Also look on the Dairy Council's website and the Ohio Action for Healthy Kids to learn more about the Ohio School Breakfast Challenge. There's actually an application out there right now that you can find out more information about that. Flipping the lens, let's look at attendance. What is the direct connection to impacting attendance? Students that are uninsured or underinsured have higher absenteeism rates, those with asthma, those exposed to lead, those with behavioral issues, student security, oral health and vision, reproductive issues. Those issues impact attendance. This information comes from the National Association of School Nurses. They also report that students with full-time nurse have half the illness and injuries that are reported to those that do not have a nurse. What we know about absenteeism, and this comes from an organization called Attendance Works, it says that absenteeism increases with each grade, and those students become more disadvantaged from school. One of the things that we see within school districts is that there's more targeted activities or interventions that are placed at the higher grade levels versus the lower grade levels because they're aiming towards those graduation rates, but we need to have the earlier intervention because that attendance rate only increases. So primary school is really where we need to be putting a lot of effort to have a long time prevention efforts and helping those families get their students and children to school. Some real basic interventions that have been proven a number of ways to help support things at the school. Hand washing, right now we're in the midst of flu season, cognitive and social skills training, increasing parent-teacher communication skills training, how are parents feeling comfortable in working with the school districts, and how are we training our teachers to more effectively communicate with the schools. And that doesn't mean communicate at them, but communicate with them. And then increase the physical activity, the breakfast, chronic disease management. Those students, we have more students with diabetes and chronic disease than we've ever had, and that's impacting their ability to learn. And school-based healthcare centers, as we have mentioned, is also a direct way where students can receive care at the school, miss less days, and do well. Thinking of attitudes towards school, this comes from the CDC and their work on school connectedness. But by the time students are in high school, 40 to 60% of all students, no matter where they come from, are chronically disengaged from school. So think about a student's attitude in coming to school in kindergarten and how we build them up to be happy in school is fun, but somehow we lose them by the time they get to high school. School engagement, what that means is that they need to have a sense of belonging, they need to like school, that teachers like them, that they're supported, that discipline is fair and effective, that they have feel engaged towards their own future, their own academic progress, they have friends and good connections and are participating in extracurricular activities. Whenever we put emphasis on those efforts, here's what decreases. We have a decrease in behavioral problems. We improve their social communication skills. They have more self-confidence, self-esteem, lower levels of depression and anxiety, and they feel better towards their self in school. When you look at that, in the areas of school, in school language, they focus on what's called school climate. All schools' improvement plans have an area focusing on school climate, and communities can help put interventions in place and support the district's school climate interventions. And when we do that, we see increase in the areas that we want, and we also see decrease in areas that cost us more money over time. This all goes back to Maslow's hierarchy of needs, and Steve Guditas is an educator out of Massachusetts, and he related Maslow's hierarchy to education outcomes. And what he showed, and this goes with Maslow's, is that we have to focus on those bottom rungs. And in order for students to have self-actualization or truly be able to achieve academically, we need to make sure that we have put things in place for their shelter, their food, their safety and security, their sense of well-being, and then the academics can take place. And how do we do that? As Tom mentioned, we have to have sustainable systemic processes. Families and communities need to be engaged in that school improvement process. We have to have a student assessment. We have to clearly understand the staff needs, their assets and strengths, and also what's missing, and provide them quality professional development and support within these areas. We have to plan realistic and achievable strategies that look at the whole child, not just the academic needs, but what is going to support the needs or what is going to hinder the needs, the student needs. Providing training and best practice policies and programs and services, and how do we put those policies and programs in effect versus writing a policy and having the policy sit on the shelf, and have effective documentation for accountability and continuous improvement. One of the ways that we're a new model or framework that has been developed between the CDC and the Centers for Disease Control and the Association for Supervision and Curriculum Development, known as the ASCD. This is called the Whole School, Whole Community, Whole Child model. And it really looks at coordinating policies, processes, and practices to improve learning and health, looking at the child's health, safety, engagement, that they're supported and they're challenged. And the blue rung really looks at what roles within the school and the community need to be involved to actually have a systemic process. In order to learn more about this model, you can go to the ASCD or the CDC's website. And what's nice is that both of these entities talk about this model, but the ASCD talks about it from an academic lens. The CDC is talking about it from a health lens. And you put those two groups together, and you have a model that can bring together what this HPIO framework is talking about, putting it into action. And I want to close with a quote from the ASCD, and it says, as we challenge communities to redefine learning to focus on the whole person, we encourage schools and communities to put aside perennial battles for resources and instead line those resources in support of the whole child. Policy, practice, and resources must align to support not only the academic learning for each child, but also the experiences that encourage development of a whole child, one who is knowledgeable, healthy, motivated, and engaged. Thank you very much for inviting me to participate in this webinar.
All right, thank you so much, Laura. Before we move on to your questions, as I've mentioned several times, HPIO plans to release 3 other publications related to education and health, in which will offer more specific policy recommendations. The topics that we plan to address are on this slide, although I'd like you to note that they're not set in stone. There's possibility of changes being made, but we chose these topics because of their potential to become statewide policies and because we believe they could have both education and health benefits. So the first publication will explore health services in schools. The second will focus on school-based policies and programs that could impact both health and education. And then the third publication will focus on aspects of education that will improve educational success in the short term, but will also lead to longer-term health benefits. So at this time, we will open it up for any questions that you have.
Okay, we do have a few questions that have come through. And just a note for everybody on the audience, everybody will remain muted. If you do have a question, please type it into the chat box. The first question that we had was about the Lumina Foundation web address, which is luminafoundation.org. The next question we had was about recording and posting slides. We did record the webinar, and we will be posting the slides as well. The next question we had was about the name of the study from Columbia that Laura referenced.
Sure. That was by Charles Vaish, and it's called Healthier Students Are Better Learners, a Missing Link in School Reform to Close the Achievement Gap. It is published in Equity Matters, research number 6. If you Google Charles Bache, B-A-S-C-H, or Healthier Students Are Better Learners, that will come right up.
And this is Becky. I can't remember for sure, but that study may be posted on the HPIO online resource page, so you can also access it there. And if it's not, it will be.
And what's really nice about that is that there's a chapter for each of the health issues and what the school can do, what the communities can do, and what parents can do. So thank you for that question.
The next question is about health education standards. What is the status of pursuing health education standards for Ohio?
Well,
I believe that there are a couple of legislators that are drafting legislation to address health education standards. This is Amy Rowling McGee.
Right.
I think one of the things I think I can say is that if you have questions for that, you can contact Kevin Lorson with the Ohio Association of Health, Physical Education, Recreation, and Dance. They're taking the lead on that policy effort.
Next question. The Alliance for Healthier Generation Healthy Schools program is active in many Ohio schools to improve health and wellness policies in schools and creating healthier school environments for students, teachers, and families. Is the state, meaning the Department of Health or the Department of Education, engaged with the Alliance on these efforts?
Hi, this is Laura. In the past, we were very engaged with the Alliance. We were working with the schools that had contracts with the Alliance and the efforts that they were putting forth on helping the schools conduct an assessment, implement strategies around nutrition and physical activity, and to improve their USDA mandated wellness policies. We welcome continued efforts in collaboration with the Alliance. Jody, I know that Jody Mitchell is working for the Alliance. We've had good communication and efforts, so we welcome more collaboration.
Next question. Is there any resource for the types of skilled credentials that young Ohio high school grads can pursue if they're not pursuing a college degree?
There are at the state level. There's been a workforce group operating, and I will share with HPIO that document. I can't recall the name of it, but it was a statewide workforce group. Also understand that within local communities, you will see that this is being done to different degrees. For example, in Montgomery County, where I am from, we identified the 6 most in-demand areas, workforce areas, and then within those workforce areas, we've identified where we see the most need in terms of the workforce for 2020 and 2025. So at the state level, you're going to see one level of analysis, and then for certain communities, you'll see a more detailed analysis. You really will have to look at what's happening within your particular county, and that's going to vary by county, the kind of data that are available.
Great. And the final question, I think, is a really great wrap-up question for us. What are some of the ways to engage local communities on this topic?
This is Tom. 2 things. First, I'll go back to my know your data. Try to understand where you stand as a county, as a community in terms of attainment. Secondly, we know that one of the absolutely critical things that we have to have in place if we're going to have the workforce of the future are good internship opportunities for our young people. The internships do 2 things. They give young people experience, and the second is, once the young person has that experience, he or she is more likely to remain in the community to work with whatever employer provided the internship. So know your data, and where possible, provide internships. Those are my 2 suggestions.
Another resource in how to engage in schools is called How Schools Work and How to Work with Schools. It was written by the National School Boards Association. I'll make sure that Becky has that to reference, but it really helps individuals that work outside of the school or a community member understand the school structure, how the roles and responsibilities of different individuals within the school, and how to approach those schools. So we'll make sure that's available as well. There's another resource that was written by the National Association of Chronic Disease Directors on speaking the educator's language. And so sometimes those of us that are working in public health, we tend to speak in data and in acronyms and our public health speak. And this document talks about how to flip that language so that it's speaking from an educator's frame of reference and understanding their accountability and how the public health can support the work of academics. So I also encourage you to look at that. There was information that was put in that by different individuals who've been working in this area over a number of years, and there's a top 10 pitfall list to avoid from those that have been trying to do this. So I'd also have you take a look at that so that you know not what to do as you're approaching the school district.
And this is Becky. I'll just wrap up that question by saying that if you're interested in obtaining some hard copies of the Connections Between Education and Health brief, you can go onto our website and order those. We've had a couple of superintendents, for instance, ask us for copies to share with school boards. So just really getting this information out there and making people aware of these connections is important. So again, thank you so much for joining us for today's webinar. You'll be receiving an email with a link to a survey, of course, after the webinar concludes. We would really appreciate hearing your feedback, and it's very short. I think it's only 4 questions. So if you could take a few minutes to fill it out, we'd really appreciate it. Well, thank you again, and I hope all of you have a wonderful weekend.